Hello, my name is Presley Davis, and I am presenting a proposal for a community-based initiative to reduce the prevalence of human papillomavirus, or HPV, in underserved populations. HPV is the most commonly sexually transmitted infection in the U.S., with about 13 million new infections annually. Despite safe and effective vaccinations, coverage remains low in many communities, contributing to preventable cancers and deaths. This presentation highlights HPV's public health significance, reviews current prevention efforts, identifies critical gaps, and proposes a $500,000 mitigation strategy involving mobile vaccination clinics, culturally tailored education, and community health worker engagement to improve access and vaccine uptake. Human papillomavirus, more commonly known as HPV, is a significant public health challenge due to its high prevalence and potential for serious long-term health outcomes. While many infections are asymptomatic and resolve spontaneously, persistent infections with high-risk types such as HPV 16 and HPV 18 can lead to precancerous lesions and invasive cancers, most notably cervical cancer. Beyond the direct health consequences, HPV places a substantial economic burden on the healthcare system as well, with the United States spending approximately $9 billion annually on screening and treatment for HPV-related conditions. The virus is primarily transmitted through sexual contact, including vaginal, anal, and oral sex, as well as non-penetrative genital-to-genital contact, making this virus completely preventable. Low-risk HPV types, mainly HPV 6 and 11, generally do not cause cancer, but can produce noticeable symptoms and conditions. Genital warts are the most common manifestation, appearing as flat, raised, or clustered cauliflower-like growths on the external genitalia, as shown in picture 1. Low-risk HPV can also cause recurrent respiratory papillomatosis, or RRP, where warts grow in the larynx or airway, resulting in hoarseness, chronic cough, or even airway obstruction in severe cases. Symptoms may include itching or mild discomfort in affected regions, and the visible nature of the warts can have a severe psychological or cosmetic impact on some patients. High-risk HPV types, including HPV 16 and 18, are strongly associated with cancers of the cervix, anus, and oropharynx. Early infection is usually asymptomatic, which is why routine screening is crucial for early detection. In more advanced stages, symptoms can include abnormal vaginal bleeding, postcoital bleeding, pelvic pain, or painful intercourse. Detecting these infections early through pap smears or HPV DNA tests allows for timely intervention and dramatically reduces cancer risk. Surveillance tools are essential for monitoring HPV prevalence and evaluating prevention efforts. HPV DNA testing is highly sensitive and effective for identifying high-risk viral types, allowing for early intervention before progression to cervical cancer. Pap smear screening, while less sensitive, maintains high specificity for detecting abnormal cytology and remains a cornerstone of cervical cancer prevention. Combining these methods through co-testing further enhances overall diagnostic accuracy. Large-scale surveillance systems such as the National Health and Nutrition Examination Survey and the Surveillance Epidemiology and End Results program provide reliable population-level data on HPV prevalence and associated cancers. These systems allow public health authorities to track trends, assess program effectiveness, and identify populations at risk. The virus is considered endemic within sexually active populations in the United States, with infection rates remaining relatively stable over time. Studies have identified minor seasonal variations with slightly lower infection rates during the summer months and marginally higher rates in winter or spring, but these differences are not statistically significant according to research. Age plays a critical role in temporal variation as adolescents and young adults exhibit the highest rates of new HPV infections due to sexual behavior patterns and lower vaccination coverage. Occasionally, localized epidemic spikes occur in communities with limited vaccine uptake or poor access to screening, which emphasizes the importance of targeted public health interventions. HPV is responsible for nearly all cases of cervical cancer, with approximately 6,482 deaths in the United States reported in 2017. The economic burden of HPV related conditions is also substantial, with an estimated $9 billion spent annually on screening, vaccination, and treatment, including management of anogenital warts and recurrent respiratory papillomatosis. Host and environmental factors plays a critical role in HPV infection risk and subsequent disease outcomes. Age is a significant determinant, with adolescents and young adults exhibiting the highest rates of new infections due to increased sexual activity and limited prior exposure. Gender also influences susceptibility. Women are at a greater risk of persistent infections and associated complications such as cervical dysplasia and cancer. Sexual behavior is one of the most significant host factors. Individuals with multiple sexual partners, early sexual debut, or inconsistent condom use face increased risk of infection. Socioeconomic status further affects vulnerability, as individuals with limited access to health care and lower health literacy are less likely to receive vaccinations or routine screenings, leading to delayed detection of precancerous lesions. Racial and ethnic disparities also exist, with Black and Hispanic women disproportionately affected, experiencing higher prevalence of persistent high risk infections and higher cervical cancer incidence. Environmental factors, including geographic location, influence access to healthcare as well. Those living in rural or medically underserved areas may face challenges obtaining vaccines or screening services. Existing policies in the United States aim to promote HPV vaccination and increase access to preventative care. The Centers for Disease Control and Prevention recommends routine HPV vaccination for adolescents aged 11 to 12 years, with catch-up vaccinations available through age 26 and, for certain populations, through age 45, based on individual healthcare provider assessments. To ensure equitable access, the federally funded Vaccines for Children program provides no-cost HPV vaccines to eligible children who lack health insurance or cannot afford the vaccine. Some states have also implemented school entry requirements. For example, Rhode Island mandates that all students entering the 7th grade receive at least one dose of the HPV vaccine, with additional doses required for subsequent grades. Public health initiatives such as the CDC's National Breast and Cervical Cancer Early Detection Program and Alabama's Operation Wipeout further support HPV vaccination and cervical cancer screening, particularly targeting women in low-income areas of the community. Current literature shows that HPV vaccination and routine screening are highly effective in reducing cervical cancer incidence and mortality. Vaccines targeting high-risk strains have lowered HPV prevalence and precancerous lesions, while PAP tests and HPV DNA testing support early detection and improved outcomes. But despite these advances, key gaps remain. Male HPV infections are underreported, even though men can develop anal, penile, and oropharyngeal cancers. Data on infection rates and vaccination coverage are limited as well. Cultural beliefs, low health literacy, and financial barriers further reduce vaccine uptake, especially in marginalized communities. Misconceptions about safety or necessity often delay or prevent vaccination. To address the gaps in HPV vaccination coverage, particularly among underserved populations, I propose a comprehensive community-based mitigation initiative. First, mobile vaccination clinics will bring vaccines directly into high-risk neighborhoods and overcoming barriers such as lack of transportation, limited clinic hours, and geographic isolation. Studies have shown that mobile health services significantly improve vaccine uptake in hard-to-reach populations. Second, culturally tailored education sessions will be offered in multiple languages, focusing on addressing misconceptions about HPV, vaccine safety, and the importance of completing the multi-dose series completely. This approach is critical because cultural beliefs, health literacy, and trust in healthcare providers strongly influences vaccination decisions. Third, community health workers, or CHWs, will be employed to provide outreach, build trust, and facilitate follow-up for adolescents and parents. CHWs have been demonstrated to improve vaccination adherence and overall preventative health behavior, particularly in minority and low-income populations. Finally, incentives such as gift cards, school credits, or small rewards will be offered to motivate adherence. Evidence indicates that modest incentives increase vaccination series completion rates without compromising informed consent. Investing in this community based HPV vaccination program offers strong public health returns. By boosting coverage in underserved populations, the initiative reduces HPV related morbidity and mortality, especially among adolescents in rural and low income urban areas where infection rates are higher and vaccination completion is lower. Economically, HPV vaccination is highly cost effective. Each dollar spent prevents costly future treatments for cervical and other HPV related cancers. Grant funding of $500,000 would enable full implementation of this scalable, evidence based program that aligns with public health priorities and delivers lasting public health benefits. In conclusion, HPV remains a significant public health challenge, particularly in the underserved communities where vaccination coverage is low and awareness is limited. While vaccines are safe and highly effective, barriers such as transportation, language, cultural beliefs, and limited health care access prevent optimal coverage. The proposed community based mitigation initiative, combining mobile vaccination clinics, culturally tailored education, community health worker engagement, and incentives, addresses these barriers directly. Approving this grant of $500,000 will enable the implementation of an evidence based strategy that reduces HPV transmission, improves equity in vaccine access, and ultimately saves lives. This initiative represents an innovative, targeted, and sustainable approach to combating a preventable disease. Thank you for your time.